Thank you for joining me for my weekly video update. This week, our nation surpassed 700,000 COVID deaths in just under 20 months. Here in Montgomery County, we've had over 1,600 deaths. This is a sobering number. To put these numbers in perspective, 620,000 Americans died during the Civil War, which lasted 4 years. The pandemic has become the deadliest event in American history, overtaking the toll from the influenza pandemic of 1918 and 1919, which killed about 675,000 people. These are not just numbers, they represent real people, and we continue to mourn and sympathize with those who lost family, friends, and neighbors and co-workers. We are very fortunate in Montgomery County to have a constituency that has taken this virus seriously and has adhered to the best practices and gotten vaccinated. We are approaching 99% of our eligible population having at least one dose of the vaccine, and our case and positivity rates remain among the lowest in the state and the entire Mid-Atlantic region. However, our county is not an island. Our residents work and move around the DMV and the state of Maryland, as do people from other jurisdictions in the region. As a result, we're interacting with people from areas of the region, state, or nation who don't have the high vaccination rates we have. For example, our county has 1/20th the death rate of our neighbors in West Virginia, a state that was one of the very last to get its first COVID case and has been consistently refusing to provide any sensible guidelines or restrictions on their residents. Now they are the deadliest state for COVID, and every day West Virginians come to Montgomery County to work and to visit. This is why I continue to ask that we remain vigilant and continue to use our mask, practice good hygiene, and socially distance ourselves when we can. Our war against COVID is unfortunately not over. We're doing well, but we can't stop doing what we know works. This week, our Health and Human Services Department announced that several county-operated vaccination sites will move to new locations to provide increased capacity for COVID-19 vaccinations. These vaccination sites will continue to provide first and second doses of Moderna and Pfizer vaccine, as well as additional doses and booster shots currently recommended for certain groups and eligible residents who receive the Pfizer vaccine. Vaccinations are now available at Montgomery College Germantown campus, and beginning Monday, October 11th, COVID-19 vaccinations will be available at the East County Recreation Center and the Silver Spring Civic Building. And the sites at Montgomery College Rockville campus and the Dennis Avenue Health Center will offer vaccinations on select days. To find out if you qualify for an additional dose of the Pfizer vaccine and to make an appointment, visit www.govaxmoco.com. Walk-ins are available, but appointments are recommended. Remember, there are over 200 vaccination locations throughout the county, including pharmacies, grocery stores, and healthcare facilities, and you don't have to get your booster or third dose at the same location that you received your original doses. There's been a lot of confusion and misrepresentation recently about my position on the proposed council legislation that would require all Montgomery County employees to be vaccinated or else be terminated. I want to be extremely clear about my position on this specific legislation as proposed. First, I believe that all county employees should be vaccinated, just as I believe that all residents should be vaccinated. I believe that vaccine mandates work and that a national mandate tied to employment would be the most effective means of preventing the unvaccinated from job shopping for employers who don't require vaccinations. The pain and suffering and the loss of life from this pandemic would be greatly reduced if we were all vaccinated. I also want to be clear that I never said I opposed the vaccine mandate of county employees. However, we're not running a bookstore here or a restaurant. Where firing staff or reducing the staff who aren't vaccinated might result in slower service for the customer. That would be inconvenient, but it wouldn't be potentially dangerous. We're running a government, and the ability to provide necessary services like police, fire and rescue, and staffing our jail are critical functions. Before we issue a blanket mandate with prescriptive discipline, we should review and be clear-eyed about the implications for public safety. That's why I've asked staff in these departments to conduct a realistic scenario-based assessment of how potential personnel losses may affect their ability to effectively deliver these services. If, for example, the loss of paramedics were to result in delays in ambulances arriving at your home, we would be putting lives at risk. Within the fire and rescue service, more than 80% of the calls they run are health-related, and before I can support the mandate as proposed, I want to be sure that it will not jeopardize the health and safety of our residents. Similarly, if our jail were inadequately staffed, we'd be putting both the people in the jail and our employees at risk. The analysis I've requested is essential to judging the risks and benefits of this vaccine mandate, and proposing a mandate without this assessment was premature. At the end of the day, we are likely talking about no more than 1,000 county employees who remain unvaccinated out of more than 200,000 residents who aren't vaccinated. Because of the other measures my administration has implemented, including personal protective equipment, distancing, barriers, and ventilation improvements in county facilities, employees, vaccinated or not, pose far less risk than more common daily interactions in retail, restaurants, or fitness centers throughout the county. These employees have been responding through the last 20 months of this pandemic to make Montgomery County one of the safest places in the entire country. A key factor in considering the consequences of this mandate is the exceptionally high challenges of replacing some of our employees. For every unvaccinated firefighter we would have to fire, for example, finding a training or replacement would take months. In the interim, what do I tell a person whose house fire could not be contained because it didn't have adequate staff? Would that person be at grave risk if an unvaccinated firefighter wearing an N95 mask fighting a fire? These are questions and legitimate questions that need to be addressed before any legislation is passed. I expect my staff to provide me with a realistic consequence analysis by next week. At that point, I will have a better understanding of what we may be up against from a service delivery perspective, as well as from a financial standpoint. I want to be sure that the cure isn't worse than the disease. At that point, we will understand with full knowledge of our circumstances the best way to go forward. Regardless of how upset I or anybody else is about the refusal of people to get vaccinated, and trust me, I am upset, that anger can't cloud our thinking about how best to manage the situation we may find ourselves in. I genuinely wish that the sponsors of this legislation would have come to me to discuss their interest in greater detail so we could have conducted this critical analysis prior to their drafting of the proposed mandate and accompanying discipline. I believe it would have shown greater respect for the employees who have been responding for the last 20 months, with many of their efforts coming during times before the vaccines, or in some cases before adequate personal protective equipment was available. That didn't happen. So now our departments will work diligently to answer and provide those answers to the County Council to ensure the best possible outcome for our residents and employees. This week, we began our regional budget forums around the county and online. We'll be hosting 3 more in the coming weeks. These budget forums are important to both update you on our upcoming FY23 budget process and outlook, and also provide opportunities for you to give input and feedback. Please attend or tune into one or more of these forums, and if you participate virtually, we'll also provide captioning in 6 languages. Our county website has the information on how to view or participate in these budget forums. This week, we proclaimed October as Energy Action Month to raise awareness of energy efficiency policies and programs to help boost economic opportunities and create jobs. This proclamation is another opportunity to promote actions, and I am committed to actually taking actions that will help us reach our climate action goals. Last month, the County Council approved the new regulations we sent over for new buildings and construction to make them more energy efficient. And now they will soon consider legislation we sent over that addresses existing buildings. The Building Energy Performance Standards, or BEPS, legislation is key to reducing greenhouse gas emissions from the existing built environment. The Council will begin work sessions to review the legislation later this month. If the legislation is approved by the Council soon, we could have regulations ready by next summer to implement. As we can tell by the deadly weather events we've seen over the last several months, we need to take action now. Helping our young people understand the importance of sustainability is critical. Choosing to walk or bike to school rather than driving helps reduce emissions and involves our children in helping the environment. On the 24th International Walk to School today, I joined staff and families at Piney Branch Elementary School to welcome the many students who walk to school along with their parents. In addition to reducing carbon emissions, walking or biking to school is good for a student's health and well-being. This is why we continue to invest in sidewalks, bicycle paths, and public safety staffing, such as crossing guards, around every school building in order to make walking or biking to school an option for more students. Finally, I want to take a moment to note that this is Breast Cancer Awareness Month. Breast cancer is the most commonly diagnosed cancer among American women. About 13% of women will develop invasive breast cancer over the course of their lifetime. 43,000 women throughout this nation are expected to die in 2021 from breast cancer. And in women under 45, breast cancer is more common in Black women than white women. Overall, Black women are more likely to die of breast cancer. For Asian, Hispanic, and Native American women, the risk of developing and dying from breast cancer is lower. The good news is the overall death rate from breast cancer has decreased by 1% per year from 2013 to 2018 due to treatment advances and early detection through screening. I want to encourage everyone to get tested for breast cancer as well as other cancers. So many of us have lost friends and loved ones who've contracted breast cancer. Wear pink to support the cause and encourage others to get a breast examination. I want to acknowledge and thank now retired Montgomery County firefighter Marshall Moneymaker, who founded For Three Sisters and became known as the Pink Fireman 10 years ago in honor of the three sisters, Vicki, Penny, and Valessa, who all passed from breast cancer within a 2-year span. Last week, Montgomery County Fire and Rescue debuted their newest pink fire truck, dubbed Vicki, for firefighter Marshall Moneymaker's oldest sister. This head-turning pink fire truck is a consistent reminder throughout our community that breast cancer is serious and should be considered a top health concern for both women and men. Thank you for the time today, and I hope you have a great week.